Good morning, good afternoon, good evening, and welcome to the AI for Good Global Summit, all year, always online. My name is Bilal Jamoussi from the International Telecommunication Union in Geneva, and I have the privilege of introducing today's keynote session, Improving Disaster Response at the Edge and in Pandemics, organized in partnership with AWS. ITU is the United Nations Specialized Agency for Information and Communication Technologies, and we are also the organizer of the AI for Good Global Summit alongside X Prize Foundation in partnership with 36 UN sister agencies, ACM, and co-convened with Switzerland. The goal of the summit is to identify practical applications of AI to advance the Sustainable Development Goals and scale those solutions for global impact. With the weekly online programming, we are reaching even more people throughout and across the globe. Now to our topic for today. Each year, man-made and natural disasters impact the lives of millions of people. Over the last 5 decades, the frequency of occurrence of these disasters is increasingly causing considerable loss of life, displacement of people, and destruction of infrastructure. Economic losses and damages caused by disasters in 2019 were estimated to be around $232 billion. Focused and comprehensive solutions are needed, covering all 4 phases of disaster management, including mitigation, preparedness, response, and recovery, in order to minimize these losses. At ITU, we believe that information and communication technologies, or ICTs, can play a pivotal role in effective disaster management by boosting disaster preparedness and response. ITU, in its role as the United Nations Agency for ICTs, has been at the forefront of sharing best practices and formulating standards to facilitate the use of emergency radio communications, along with the Internet of Things, unmanned aerial vehicles, digital twin technologies, etc., to counter the issues associated with disaster management. Before I introduce today's speaker, let me go over some housekeeping rules. If you wish to ask a question, please use the Q&A tab. We will identify and read out the question to the presentation. And we are particularly counting on your participation to create a very interactive session. And speaking of being interactive, I have the first challenge for you. Please let us know where you are connecting from, which country or city. Please use the chat function and make sure to send your message to all panelists and attendees. Now I would like to introduce today's speaker. Really a pleasure to introduce Grace Kitzmiller, Principal for AWS Disaster Response Program at Amazon Web Services. Grace, welcome. The floor is yours.
Thank you. Let me go ahead and share my screen as well. All right, perfect. I'm hoping that you can see the title slide.
Yes, it looks great. Thank you, Grace.
Okay, great. Perfect. So first off, I just want to say thanks so much for joining today. And thank you to the AI for Good Foundation for running this virtual summit and all of the topics and just really great topics that have been covered throughout the summit. And Bilal, thanks for being a co-panelist and moderating the session. I'm truly excited to be here today to talk a little bit more about how AWS is supporting disaster response at the edge and in pandemics. So actually what I want to do is start off by diving right into an example of how an edge solution was put into action during a disaster. Now, for those of you that might not be familiar with Hurricane Dorian, it made landfall in the Bahamas in September of 2019 as a Category 5 storm and set the record for the worst natural disaster to impact the Bahamas ever. It also became one of the 2 most powerful storms to ever make landfall from the Atlantic Ocean. Now, in response to Hurricane Dorian, an organization called Help.NGO and their Disaster Immediate Response Team activated to support the responders on the ground. Now, the mission of Help.NGO is to try to fill that void that exists between the time when a disaster occurs and the time when a more traditional response effort is fully in motion. Now, when they activated, some of the primary activities for Help.NGO to complete were to fly drones daily over Abaco and other impacted islands. And they were looking for ways to process and share that aerial imagery more quickly than they had been able to do in the past in order to support situational awareness, resource allocation, and decision-making by the leaders in the command center at that critical time. So they wanted a solution that could support their full pipeline of taking raw imagery and turning it into processed imagery. They knew they needed a solution that had a large storage volume that could handle that influx of imagery that might happen every day as they completed their overflight missions. They also needed to be able to run their image processing software much more quickly than they had been able to in the past in order to generate those processed images. And the solution needed to operate in limited power and limited connectivity environment, and it had to be portable and ruggedized to be effective in the conditions in the Bahamas. So Help.NGO reached out to AWS with these needs, and the disaster response program assessed those solution requirements and determined that a solution using an AWS Snowball Edge device was a good fit. Now, to support that implementation, the disaster response volunteer team deployed with Help.NGO to help assist in getting the pipeline set up and being able to process that imagery and making it available to the command center and other stakeholders much more quickly than they had in the past. So now you might be asking, well, what is a Snowball Edge and how is it really helpful? Well, this slide shows a picture of an edge device. And this is a member of what's called the AWS Snow family, and there are a couple other variations of this, but this particular Snowball Edge compute optimized device weighs a little bit less than 50 pounds or 22 kilograms and is about the size of a large piece of oversized luggage, right? Not the kind that would fit in your overhead bin on a plane, but the kind that's just a little bit too big, so you have to check it and can't bring it on the plane with you. Now, a Snowball Edge is really like having a little bit of the AWS cloud in a box that's portable and ruggedized that you can take with you to operate in connected or disconnected environments. The Snowball Edge is tamper resistant and tamper evident. The data are encrypted using 256-bit AES encryption, and it operates on unconditioned power and in austere environments. The Snowball Edge compute optimized device can store up to 42 terabytes of data and provides 200 gig of processing power, and can also be ordered with an optional NVIDIA Tesla V100 GPU card, which means if you have some very compute intensive workloads, such as machine learning operations, you can run them much more quickly at the edge as well. Now, when we talk about the Snowball Edge being like having a little bit of the AWS cloud in a box, this is because the Snowball Edge runs many of the same services that run in the cloud, including Amazon Elastic Compute, Amazon Simple Storage Service, Lambda, and Elastic Block Storage. So many of the same applications and resources that an organization is running in the cloud can also be provisioned to and run on a Snowball Edge in both that connected or disconnected environments. So when you're thinking about, as and when a disaster occurs, what are those most critical data sets that you'd like to bring with you to the field? Well, you can bring up to 42 terabytes worth. And when you think about what are those most critical applications that you want to be able to run as a crisis is evolving or during a recovery, well, you can provision those applications onto the Snowball Edge and bring them with you to run whether you have connectivity or no connectivity. You also have the flexibility to install other solutions once you get out into the field as you need them. And with 42 terabytes of storage, you have plenty of room to do new data collection activities as well. And when connectivity is restored, you actually have the ability to either sync your Snowball device back up into the cloud, or when you return your Snowball device, AWS can actually copy that data back over for you into your AWS account. So this slide shows an image or picture of the workstation in the Bahamas where the imagery processing was done. So when a drone returned from a flight, the SD cards were connected up to a laptop, and then that information was copied from the laptop to the storage repository on the Snowball device. Next, the compute containing the imagery processing software was started up. And because we had 200 gig of processing power available, we were, excuse me, Help.NGO was able to run this processing pipeline with a set of 9 images running in parallel. 9 processing systems running in parallel. So they could create those two-dimensional images very quickly and get those out to the command center, and then follow up with the more detailed 3D images later in the day. Using this, excuse me, using this pipeline, Help.ngo was able to get that imagery out much more quickly to help inform the decisions that were being made in the command center about resource allocation, situational awareness, and next steps. And we're actually seeing many institutions and organizations that are interested in this kind of flow, because there are many scenarios, especially after a disaster or during a crisis, where connectivity may be spotty, and it may be helpful to be able to run these kinds of workloads at the edge. So what is the AWS Disaster Response Program, and how did we activate and engage in order to support Help.ngo? The AWS Disaster Response Program is an initiative focused on helping non-government organizations, nonprofit and humanitarian organizations, and government agencies and ministries with applying technology to accelerate or expand their response and resiliency capabilities across both the natural disaster and the crisis life cycles. We work backwards from the needs of organizations to help solve the biggest infrastructure and technology challenges that they encounter while preparing for, responding to, or recovering from a disaster or crisis. And we do this through three mechanisms: people, information, and technology. Now, on the people side, we engage with AWS experts to assist with those technical challenges and provide support, whether you're working through bushfires in Australia, wildfires in the US, COVID-19, hurricanes, typhoons, earthquakes, and more. And we support organizations both in the field, at least prior to 2020, or remotely. And when we deploy, our trained technical volunteers can assist with needs such as networking, restoring connectivity, situational awareness, image processing, edge compute, and more. Now, our remote volunteers also support after disasters and on an ongoing basis through digital and distance activities, including call center support, technical support, predictive analytics, online mapping, and related activities. Moving on to information, there's a vast amount of information that organizations active across the disaster life cycle are starting to use or have been using, including things like geospatial, population, weather, terrain, event, street map data, and much more. Many of these data sets are available on the AWS Open Datasets program site, and there's also a COVID-19 data lake available on the AWS Data Exchange, but many other sources of information that can assist. And we're working with organizations to connect them with information providers, or assist as they curate data. And we're seeing more and more customers looking at how to aggregate, analyze, and visualize data using data lakes on AWS to support their mission analytics and their decision making, and also exploring how to apply machine learning for predictive and post-disaster use cases. From a technology perspective, again, we work with organizations around their technology gaps and use cases, and help identify how AWS services and technology and AWS partner solutions could either meet or be extended to meet their needs. So that was some detail on what we do. So let's briefly jump into, the why, when, and how. So why we do it, recognizing that preparedness is a key component of resilience. We work with customers to establish a playbook for that solution support and activation of volunteers before a disaster happens, so that we can operate much more quickly during a time of need. When we do it, well, response levels are based on the severity of the incident and the customer need. And how we do it, again, we maintain that roster of technical volunteers who are skilled in networking, software development, communications, and AWS services to help support. Now, this slide, I'm sure, is familiar to many. The disaster lifecycle includes preparation, response, recovery, and mitigation. And each one of these phases has important considerations. And as you look across this life cycle, many organizations are just beginning to explore how technology could advance or accelerate their missions in times of urgent or emergent need. Earlier this year, from a preparation perspective, in one of the few in-person conferences I attended, I heard something that's really stayed with me, and that is, hope is not a plan. Now, quotes like this quote and variations of it have been attributed to, many different people. But thinking about it in the context of disaster and crisis preparedness, the thought that, I hope a hurricane or typhoon doesn't make landfall here. I hope a tornado doesn't touch down. I hope there isn't an earthquake, or I hope COVID cases don't spike in my town. This is a common plan for many, and unfortunately it doesn't position for the best outcomes, either individually or for the communities that may be impacted. And preparation flows into response and recovery and mitigation. The better prepared you are, the more nimble you are when those plans don't exactly turn out as you had hoped after a disaster occurs, and you need to adapt and make changes quickly on the ground. So with preparedness in mind, the disaster response program engages with organizations to understand what are those critical data sets, what are those critical applications that would be needed, and how can we engage on these topics today to better prepare for that response tomorrow. Now, many organizations aren't necessarily familiar with the cloud and how technology can help. So for those who are new to the cloud, AWS is used across virtually every business sector and every vertical, from databases to storage to compute to websites and application hosting, backup and recovery, call centers, machine learning, modeling, even gaming. There are many ways that technology can contribute to resilience. And when we work with an organization, we really start the exploration with a few basic questions. What are those data and applications that you might want to be able to access, say, immediately after a disaster, or 24 hours, or 3 days, or a week, or a month later? What do you do today if you can't access those resources, either due to a physical barrier, such as building damage or flooding, or because you simply can't get to a building due to COVID-19 stay-at-home, quarantine, or no travel policies? And what would be the impact of, limited access to power, limited connectivity, or limited ability to travel on your business or on your mission? Also, what tools and solutions do you use to gain situational awareness in those low or no connectivity environments? Is access to geospatial or drone imagery important? And have you moved to a more remote model for triaging and assessment? And then last, but also at times more importantly, is there an opportunity to analyze existing data sources to develop insights into the areas most likely to be impacted and use the results of those analyses for planning and preparation? Now, these questions can seem very overwhelming when an organization gets started, but working through these questions helps surface the areas of need where AWS and cloud technology can help. So, and just switching over to pandemics now, these were some of the very same questions that we asked organizations that were faced with unexpected impacts as COVID-19 progressed around the globe. Earlier this year, the AWS Disaster Response Program and many Amazonians across the organizations activated to help support customers in their response to COVID-19. We engaged to understand the challenges they were facing and the needs they were encountering and how AWS could help. And our efforts to assist continue globally today. The list you see here shows many of the common challenges and solutions that we heard from many organizations. And as you read this list, you can recognize these are not necessarily unique to pandemics. Many of these are also encountered after a natural disaster and other types of crises occur. One of the key differences being that with COVID-19, access and business as usual were not prevented by, say, physical damage, and connectivity wasn't lost. The challenges were due to, say, the impacts of COVID-19, impacts of mitigation measures such as stay-at-home, social distancing, and quarantine orders. And some resulting business closures just meant that many services were just not accessible. So let's dive into a few of these in just a little bit more detail. So business continuity, remote work, remote learning, and infrastructure scaling. Many businesses and schools found themselves having to scale their infrastructure quickly to be able to support a significant increase in remote work or remote learners, or to provide remote access for the first time. Simple things like not being able to access email, or relying on paper files, or not being able to access electronic files such as learning materials made it difficult to operate and made it difficult for students to learn. Now, we worked across a number of organizations that found they could quickly migrate their existing systems to the AWS cloud, or if they were already in the cloud, they could elastically scale their infrastructure to meet that increased demand, or set up new infrastructure as needed to keep businesses running and keep students learning. In just one example, AWS supported Brazil's largest K-12 system, Somos Educação, in extending their online education to over 1 million students and faculty. And also in Brazil, we supported the Sao Paulo state government with cloud computing infrastructure to offer online classes to benefit over 1 million high school students. Next on the list, as community concern levels escalated and people wanted more information about COVID-19 or just didn't know whether they should be concerned about the symptoms they were feeling. This resulted in call centers being overwhelmed and hospitals that saw long lines of patients waiting outside their door. So in order to help address these spikes in call volume and that overwhelming demand that was placed on hospitals, doctors, nurses, and medical professionals, many organizations either expanded their call centers or built tools such as triage chatbots and symptom checkers with Amazon Lex, which we'll talk about in just a few minutes. And we also saw many organizations looking at how to scale and accelerate their bioinformatics research using the cloud. So let's dive into the technology just a little bit and a few specific examples. So whether with COVID-19 or before or after a natural disaster, communities want more information. They want it faster, they want status updates, and they want to know what resources are available to them. With COVID, there was so much demand for healthcare services, and hospitals were having difficulty load leveling to handle that influx of patients. And then in addition, keeping patients and medical professionals protected was a challenge. So chatbots and modern call centers can provide organizations with an efficient way to connect with their communities at scale during these critical times. In the past, call centers could take months to set up, and there really just wasn't time to set up and staff that call center in order to respond to those communities' increasing demands. So one solution that meets these needs is Amazon Connect. It's an omnichannel cloud contact center that can be set up in minutes rather than in months. Amazon Connect actually grew out of Amazon's retail operations team when it was looking for a contact solution that could meet the scale that they wanted and provide an engaging experience and a quicker and easier way to stand up a call center and to support a remote workforce. In addition, Connect also incorporates a set of machine learning capabilities called Contact Lens for Amazon Connect. Now, this service can automatically transcribe voice conversations, enable search, and can actually apply machine learning to extract trends and sentiment analysis. Now, this information can be really critical when you're in a scenario such as with COVID-19, when you're trying to understand, what are the kinds of information people are most interested in finding out first, and where might be opportunities to better communicate and share the resources that are most sought after. So let's dive into two examples of how Connect was used both in a disaster and in COVID-19. Now, when Hurricane Harvey hit the coast of Texas a few years ago, it poured almost 52 inches of rain into the Houston area and caused $180 billion of damage. Now, the American Red Cross jumped in by deploying hundreds of volunteers to provide food and shelter and support people that were looking for help. But with Harvey, even the Red Cross's adaptive abilities were challenged. The scale of the disaster and the amount of damage and assistance that was required just caused a flood of phone calls to their call center, and they found themselves quickly overwhelmed. So the Red Cross engaged with an AWS partner by the name of Voice Foundry, which is an expert in the implementation of Connect. And within 48 hours, actually, the team had set up an entirely new call center, established routing rules, and had trained new operators. And this was a process that would normally have taken 4 to 5 months for a call center of equivalent size. In addition, the AWS disaster response team actually activated remote volunteers to help staff the call center and increase the ability to serve community members. Now, after about 2 weeks, calls and requests for support really trailed off, and that Connect's call center was no longer needed. So it was easily deprovisioned in less than a day, and the Red Cross was no longer charged for any resources associated with that Connect environment. Now, more recently with COVID-19, we've seen how Connect can also be connected into remote monitoring and outreach approaches. So as demand for emergency services spiked in New York City, New York Health and Hospital, which is one of the largest state-owned hospital systems in the US, knew they needed a better solution. And they wanted to implement a remote patient monitoring solution. So they worked with a UK digital healthcare company by the name of Lumion. And in just a week, they were able to design and deploy a COVID-19 remote patient monitoring solution. This system uses a range of AWS services and actually alleviates the pressure on hospitals and clinicians by doing a digital screening of patients and allowing patients to self-enroll into an SMS-based home monitoring program. This monitoring program will call out to these enrolled patients on a daily basis and ask a series of questions to help assess any changes in their symptom severity, any new trends in their in their symptoms. And as patients respond, if needed, the system can automatically escalate patients who need more attention or potentially a virtual consult or an in-person consultation onto treatment. Now, although this was created for times when this, like COVID-19, when a rapid response is needed, they're also looking at how it can be deployed to better manage capacity and operations on an ongoing basis. Turning to chatbots and symptom checkers in a little bit more detail, in addition to expanding and scaling call centers, healthcare systems were looking at different approaches to how they could level out the load that was being seen on healthcare professionals. Really sometimes just answering general requests for information were redirecting the precious time and attention of doctors, nurses, and others from providing care and attention to those who needed it most to just responding to general information queries. So to help address this spike in requests for information and to really meet people where they were, maybe give them an opportunity not to have to travel to a location to find more information, many organizations started building tools such as triage chatbots. And this could help scale interactions with the members of the community who either had symptoms or just wanted more information. These chatbots would use clinically validated triage protocols that were wrapped in a chatbot that was built using Amazon Lex. Now, Amazon Lex is a service for building conversational interfaces into any application using voice or text. Amazon Lex provides deep learning functionalities, including automated speech recognition for converting speech to text or text to speech, and natural language understanding to interpret and understand the intent of a text or language, and to enable and to enable users to engage with lifelike conversational interactions. Amazon Lex actually uses that same deep learning technologies that power Amazon Alexa. So if you've used an Alexa, you have an idea of what some of those interfaces and interactions can be like. In two examples of chatbot implementations, the University of Washington Medical developed an Amazon Lex-based chatbot that could streamline screening and guidance for people who wanted to know if they might have COVID-19. The university wanted to triage these patients quickly so they could provide those who didn't need testing peace of mind, and for those who did need testing, they would have the opportunity to schedule that as soon as possible. This chatbot walks through a series of questions related to symptoms to assess the need for testing. It operates 24 hours a day, and in addition to the voice version of this chatbot, they actually also implemented a text-based version on their website, providing more opportunities for the community to gain more information. In a similar example, in North Carolina, UNC Health was seeing the same thing, just unprecedented call volumes related to COVID-19 on their helpline. So they also built a chatbot using these clinically validated symptom checkers to provide guidance to callers who wanted more information about COVID-19 or what to do if their loved ones were exposed to the virus. And then one last example, actually, an AWS partner by the name of Impego in Canada, they actually developed a free online survey and triage tool to help healthcare professionals identify high-risk cases in Quebec. Early in the outbreak, the tool was used more than 300,000 times and greatly contributed to relieving the load on government hotlines and quickly detected tens of thousands of high-risk cases and escalated those patients for additional intervention. Now, in another example around scaling infrastructure to meet increased demands for information using the cloud, the World Health Organization recently launched the WHO Academy app in order to support healthcare workers around the world that were caring for patients infected with COVID-19 and provide them information and training around that care, but also how to protect themselves as they do this critical work. This app is available from the Apple App Store, Google Play Store, and it's provided in Arabic, Chinese, French, Russian, Spanish, and Portuguese, and enables healthcare workers to access WHO's ever-expanding bank of COVID-19 learning resources and guidance. Now, AWS supported this initiative by helping provide the elastic infrastructure that was needed to scale this resource through free hosting services so that WHO Academy could actually launch this app and make it available globally and make it available at scale. Now, let's take a look at how do you put all of this together, from infrastructure scaling to chatbot to call center to telemedicine to escalating to an in-person consultation. One organization, Babylon Health, located in the UK, used AWS to help scale and distribute their COVID-19 care assistance and their COVID-19 care pipeline to help really alleviate the burden on the NHS in the UK. Patients can use this COVID care assistant in order to check their symptoms, track their illness, and then also cope with self-isolation, chat with trained staff, and consult with doctors. The slide you see here is from a presentation by Dr. Ali Parsa, who's the founder and CEO of Babylon Health. What they found with this approach is that from all of the calls that came in through their AI symptom checker, about 20% of those were escalated to video consultation. And from that video consultation, only 1 in 10 of those consultations led to a referral to a clinic for in-person care. And they found this was just so instrumental in safeguarding doctors' time so that they had the ability to see the most in-need patients. In another example of an organization really integrating these resources together through call center with Connect, chatbot with Lex, and telemedicine solutions is Dr. Anywhere. Now, this is a Singapore-based telehealth platform that serves over 1 million online and offline users in Singapore, Vietnam, and Thailand. So really, directly from anywhere with the Dr. Anywhere app, patients can call a licensed doctor on demand and receive medical advice in just a few minutes. They can also have medication prescribed, delivered, or picked up. And if needed, they can schedule in-home visits for procedures such as blood tests, vaccines, and occupational therapy. In addition, with Dr. Anywhere, these users can actually access their healthcare information, including their healthcare history, previous consultations, all in one place from within this app. Now, Rishik Bahri, who's the Chief Technology Officer for Dr. Anywhere, stated that, really since the start of the pandemic, they had increased a 3- or 4-fold increase in demand for their services, and downtime was really not an option. So using AWS, they were able to guarantee high reliability, low latency, and deliver a better patient experience and automate their service delivery so that they could serve more of their community, serve them more quickly, and also make it easier to manage for their IT team. Now, as COVID progressed, we also saw many organizations looking at how to accelerate their bioinformatics research through access to core services on the AWS cloud. Like, how could they make their research go faster? By having access to a more scalable infrastructure, more compute, more storage, and a faster way to run their machine learning model development, they would be able to really generate those research outputs much more quickly. So this slide just lists a few examples of resources that you can check out. There's a public AWS COVID-19 data lake at this link. There's also a tool called AWS Service Workbench that is an open source tool set to help researchers quickly and securely stand up cloud-based research environments and collaborate on data sets with peers from other institutions. If you're interested in having access to your own supercomputer for a day, here's a quick blog post that can help you advance your research through that, and a few examples of how genomics are being done in the cloud today. So last, I'd like to wrap up, and I know we've covered a lot of ground here with the AWS Diagnostic Development Initiative. Now, this initiative was launched in March of 2020, really as an effort to support researchers around the world in developing faster and more reliable diagnostics for COVID-19, which is becoming so critical for return to work, return to school initiatives. And one DDI participant I'd like to highlight in particular is a collaboration between the University of British Columbia, Vancouver General Hospital, and a number of other researchers and organizations. Now, UBC developed a machine learning model using artificial intelligence, as well as open data that does COVID-19 diagnostics on CT scans. And this collaborative project includes contributions from over 100 people from UBC, VGH, as well as medical, computer science, and engineering students. The researchers have recently open sourced this model so that others around the world that are looking at, significant requests for radiologists to review CT scans can actually take a look at seeing how this model might accelerate some of those review processes. And the team also launched a website recently where researchers can temporarily upload their own CT scans and see the model outputs and where certain opacity patterns that are indicators of COVID-19 might have been found. Again, we did cover a lot of ground in this session, and I'd encourage everyone to continue to think differently and expand your thinking about how technology can assist at the edge and in pandemics. And for more information on the AWS Disaster Response Program, I've provided a few links that you can visit here. With that, I'd like to say thank you and turn it back to Bilal.
Thank you very much, Grace, for an excellent presentation. You certainly, as you said, covered a lot of ground, from very concrete, practical examples on the ground to a number of AI and machine learning applications that helped in the pandemic, and a number of edge-based solutions that were brought to a number of disasters that you covered in your presentation. So, ladies and gentlemen, this is now the time for your questions. We have, as we mentioned at the opening, there is the Q&A button in the middle, bottom middle of the Zoom application. If you could click there and type your question, we will take them in turn. Perhaps as you're doing that, I'd like to maybe start with the first question, Grace. If I have a very lean team that's not very deep in machine learning experience, how can I leverage these technologies today and accelerate workforce adoption for tomorrow?
Sure. Excuse me. So AWS actually offers several fully managed machine learning services that you can start using immediately without deep knowledge or deep experience. For example, there's Amazon Comprehend, which can analyze text documents for you in order to identify entities, relationships, and sentiment. There also is Amazon Forecast that can help you build statistical forecasting models from your existing data and help generate insights to inform future decisions. There are also quite a few training resources that are available on the Amazon website that you can use to jump in and dive into different machine learning activities.
Great. Thank you very much. Again, ladies and gentlemen, I encourage you to type your questions. I know that I see that a few of them have been answered already in the chat, in the Q&A box. So thank you very much for those questions and answers. As you queue up perhaps some additional questions, let me ask you the second one. Grace, I have another question. What are some best practices and lessons learned from customers you have helped through disaster response and recovery? Are there best practices specific to IT and organizational resiliency that you can share?
Sure. So I think a couple things are important to keep in mind. First, preparedness is key. Really taking an inventory of the resources that you have today, and really thinking hard about, what would happen if access to those resources were interrupted in some way for whatever reason. And then starting really a methodical process of thinking about, what do I need to do in order to try to mitigate those kinds of impacts? So I think one of the really interesting things that we learned from COVID-19 was, and I talked about this a little bit, many businesses hadn't really fully enabled remote work, and many schools hadn't fully enabled remote learning. So really being in a position to not only scale your infrastructure to elastically up and down in order to meet those increased demands was something that, with a different eye towards thinking about preparation, a different eye towards thinking about, what's that degree of risk and what can I do today to better prepare for tomorrow?
Great, thank you. How do I choose an APN provider from the AWS Disaster Response Partner competency?
Sure. So the AWS, there is an AWS Public Safety and Disaster Response competency. And if you search for that, you can find more information about it on the website. Within that website, what you'll see is each partner has a specific, set of core functional areas that they're expert in. And basically, as you take a look through those core capability areas, you can look to see how they align with your specific requirements. So it's a very easy to access portal that you can use and search through at any time.
Okay, great. Thank you very much. Perhaps I turn to some of the questions from the Q&A box. This presentation has covered a lot of solutions aimed at disaster response. Are there any other proactive efforts from AWS to increase responsiveness in the context of an uncertain future? Oh,
in the context of an uncertain future. So I don't want to just come back to preparedness, but I think some of the things that we can do is start to really turn to look at what are some of the emerging areas of challenge related to, say, disasters or things like climate change or sustainability, and how those impact the need for preparing for different kinds of response activities. So really thinking about, are there opportunities to make use of existing data and information, aggregate those together, say in a data lake, and then start to, apply the expertise of subject matter experts in these different areas to start to develop those insights that, can really be socialized and discussed and thought about in a broader way, and to develop strategies for others moving forward.
Okay, thank you. A question from Kimberly. How much do the trained volunteers do compared to what the company or organization needs to provide themselves? And perhaps how does AWS Disaster Response supplement these efforts?
Sure. So in general, when the AWS Disaster Response program deploys, we deploy in combination with an organization that is already on the ground related to a disaster response, on an activity related to a disaster response. So we deploy to meet specific needs that there's been a request for support for. And in general, we do train our volunteers both internally and then also train with organizations that are active in disaster response, such as NetHope or ITDRC, to better understand, what are some of those connectivity solutions, what are some of those resiliency solutions and networking solutions that there might be a need for support for. So it all starts with really understanding what kind of need there is on the ground. And then generally we'll deploy volunteers that are skilled in that area so that they're able to operate as independently as possible, but of course, under the guidance of the organization that's already active on the ground.
Great, thank you very much. I see a question from Eric asking, where is the location of the AI for Good? We are based in Geneva. The AI for Good Summit is organized by the ITU in partnership with XPRIZE and convened with Switzerland. So that's the answer to that question. I'd like to see if there are any other questions from the audience. If not, I had one also in the context of some of the applications you mentioned that do diagnostics of in the sort of AI for health. I just wanted to mention that we do have a focus group in the ITU, the Artificial Intelligence for Health Focus Group. It's an open platform of experts, both medical doctors and technologists, that look at basically benchmarking the various AI solutions to see how good they are versus a doctor's diagnostic. Certainly an effort that we would welcome AWS and other partners to join. Perhaps you can say a few more words on that. I think you mentioned it's Dr. Anywhere and also Babylon. If you can shed some light on those efforts there.
Sure. So the Babylon Health solution actually integrated, really from a call center up through symptom checkers and into telemedicine consultation. So are you asking if the AI that they're using across that escalation process is something that would be would be a good topic for discussion across the AI for Good health component?
Yeah,
okay.
Basically, yes. Because it seems like a successful effort that uses AI and uses of the technology that you provide. So,
Sure. Yeah, absolutely. So what we can do is we can reach out to the organization and put them in touch with you so that they can learn more about the initiative. And similarly for Dr. Anywhere.
Fantastic.
Happy to do that.
Great. Let's see. Perhaps another question from the Q&A. Do you have any checklist for disaster preparedness for organizations to use as a simple assessment form and to facilitate disaster management coordination and effectiveness?
So this is something that we've been hearing more and more from the organizations that we work with. We don't have a formal checklist at this point in time, but we welcome your input and welcome the input of other organizations into really thinking about how to pull that together in a way that's useful and could help inform preparation activities moving forward. So I'm not sure who asked that, but would love to talk more about that.
It says webinar attendee. It's anonymous.
Okay.
Yeah. Another question is that we would like to build an application that automatically geolocate the COVID positive tested patients everywhere he's located. Does AWS infrastructure support the mapping tools with the GPS?
So yes, and actually there are many organizations that are doing work around, plotting and mapping areas with where COVID positive cases have been identified. I can follow up, maybe after this session with a few links to some of those resources that are already out there.
Great. Good. I think we covered most of the questions. Some perhaps also deal with a humanitarian org working in the field. How can we partner with AWS Amazon Response Program? So it's a humanitarian organization asking, it's Anoop Sharma, how to partner with AWS.
Sure. Yeah, absolutely. And I believe the slides will be posted and be made available, but
Yes.
You should definitely take a look at reaching out to aws-drp@amazon.com. Or of course, you can reach out to me on LinkedIn as well. Would love to learn more about what your needs are.
Okay. One more related to satellites. Would you have examples of AWS capabilities using satellite data, open source like that of the European Space Agency, and combining data from various disparate sources, sensors, drones, etc., social media for disaster response using data cubes, for example?
Sure. So a couple resources to keep in mind. So there are many geospatial imagery data sets that are already made available on the AWS Open Data Program. And there are, I'll say, quite a few organizations that are collectively pulling together to look at how these different kinds of data sets could be aggregated and combined to inform, say, predictive analytics and preparation and planning for the future. So again, I'm not sure who asked that particular question, but happy to, connect and discuss in more detail, really what are opportunities to really merge some of these pieces of data together to inform analysis and projections. Now, one thing to keep in mind, there's such a large volume of data, and you can easily find yourself in a situation where you're really trying to aggregate information across so many different vectors that it's hard to understand, or hard to dig out the insights that you're really trying to find. And so this is where things like machine learning can really come in handy. And also, really recommend thinking about what are some of those first questions that you would like to have answers to, right? Mm-hmm. Think about what are those first use cases that will really help you really refine those analyses and those pipeline, develop some learnings along the way, and then look at how do you, really take those learnings from those first use cases and extend them out across a broader set of questions.
Okay, that sounds great. What about data collection during disaster? How can we, look at that issue and perhaps address it from security perspective and also sharing perspective?
Mm-hmm. Let's see. So data collection during a disaster, we often hear that there's a disruption in connectivity, which can make that data collection and data sharing very difficult during a disaster. So one of the things we found with the Snowball Edge is, if there is data being collected in, say, out in the field, one thing you can do is actually have a version of your sort of aggregation platform for that data running on the Snowball Edge. And as that information comes back, you can easily, load it back onto the Snowball and have it accessible to your software that's running on the edge. Now the Snowball Edge itself, it is a secure device. In order to actually operate and run a Snowball, there are a couple security protocols that are in place. There's a need to have something called an unlock code and a manifest file to actually open up, or not open, but to actually activate the device. And then all of the information that's stored on a Snowball is encrypted at rest with 256-bit AES encryption. So without those access credentials, there's really no way that anyone can actually see into the information that's on the device.
Okay, thank you. Another question from Egypt, Rami Fahmi, asking, have you worked on some specific use cases where you have integrated the CAP protocol, the Common Alerting Protocol, with IoT systems in AWS?
This is not something that the Disaster Response Program has worked on to date. There are some integrations of the Common Alerting Protocol on the Alexa devices. And what I can do is I can actually take that question back and provide some follow-ups with more information on that.
Sounds great. And Rami is one of our vice chairman for the IoT and smart cities, so we'll be able to connect easily. Thank you, Rami, for that question. Okay, it looks like I think, covered most of the questions that I'm seeing on the Q&A. Perhaps one final one in terms of sensor fusion for increased situational awareness for decision makers. Is the Snowball Edge an ideal vehicle to process and display this information from a variety of sensors in disparate forms? So connecting, go ahead.
So yes, and I could just give a really brief example. We actually participated in a field exercise with Verizon in earlier this year and then late last year, where we incorporated actually sensor data that was being location information for responders that was being propagated over something called long-range digital radio, or LoRaWAN. And that just, it doesn't require connectivity. It just required a LoRaWAN gateway antenna that could just propagate that signal and that information back directly onto the Snowball device. So depending on the communications protocol being used by the IoT sensors, that information could be propagated back, say, to a Snowball device. But of course, IoT sensor and sensor fusion data is being propagated back to the AWS cloud on a regular basis by many customers.
Sounds great. In the ITU, in our development sector, we often send phones in the past, phones, both satellite and GSM stations that are used in the disaster location to help countries deal with disasters. And of course, over time, it became not only voice, but also data communication that is necessary. So now we can envision also having some of these edge devices that might be dropped in at disaster locations to help countries deal with disasters as they come up. I think we're getting close to the end. I really thank you very much, Grace. You've covered a lot of ground and many questions from different angles on the issue. Thank you very much for really being with us today. I thank all the audience and the participants for your participation and questions. We invite everyone to join us in the following AI for Good sessions. On the 13th of November, we have the AI for Good perspectives from the Butnar Foundation, using AI to reshape our health and well-being. And Butnar is one of the very active participants in the AI for Health focus group that I mentioned, Grace, earlier. And on the 13th, we also have another one on the go, Becoming Human 2.0, Wearable AI and Future of Human Augmentation. On the 17th of November, AI for Good webinar, AI for Good Developing World and Esports, a real opportunity for change, growth, and prosperity. On the 19th of November, AI for Good Innovation Factory, AI for Good Innovation Factory, the big finale. And I would like to thank you, of course, all of our partners, sponsors, and co-convener Switzerland. I thank you very much, and we'll see you next week. Bye for now.